Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, May 13th, giving you the update from Albany Med. All right, first graph, Capital Region, people in the hospital with COVID. We're currently sitting at 72, again, moving in the right direction.
Absolutely, Dennis.
Yeah. And as we mentioned on Tuesday, let's take a look at the state graph, because this is very dramatic. So if you look at this, these are the same numbers we've always talked about in the Capital Region, only this is all of New York State. And what you can see is currently across the entire state, Fred, we have 1,852 in hospital beds. But the peak was 18,825. So for all intents and purposes, 10%.
10%.
And it's really dramatic. You can even see that graph coming down quicker over the last couple weeks.
That's right.
Next graph here, admissions and discharges to the medical center. Noteworthy for the fact that yesterday,
we didn't have any admissions.
None. Some days we have one or two, but yesterday was none, and that was great.
And my expectation is we'll see more days like that.
I sure hope so. So last graph here, where do we stand this morning at the medical center? We currently have 14 in the hospital, 9 are on the floor, 5 in the ICU, 2 on ventilators. All 14 are adult population. I think the youngest is 32 years old.
Yes.
Fred, 14, we talk about this, incidental findings. This would be, I'm not coming in the hospital short of breath with a fever, coughing. I'm coming in the hospital because I have appendicitis and they're testing me before I go to the floor. Of those 14, how many are incidental?
So Dennis, I think today there are 5.
5.
And so, every day or every other day we pick up an admission that's positive.
Okay.
But here for something else, as you said.
Very good. So speaking of testing, Fred, from the beginning of the pandemic, we've also been testing people who come into the hospital before procedures, right?
That's right.
So preoperative testing. Give us an idea over the course of that time, how many people we've tested, how many have been positive, and are the rule sets changing?
So Dennis, the testing mandate started over a year ago.
Right.
And so we've been doing this for a year. We have tested 35,983 patients.
Okay.
Pre-procedure.
Pre-procedure.
So almost 36,000 people.
Right.
And we have detected 185 positives.
Okay.
So that's about 0.5% of the population we've tested. And if you look at it over time, it's all clustered where there's been a very high incidence in the community. So back in January, where 10 or 11% of tests were positive, that's when we saw a lot of this.
And so our experience is similar to the experiences throughout the state.
Absolutely. And we talk about this on the regional call. So the other hospitals in the region are doing the same thing. To give you context, in the last week, we've tested about 700 people. We've had 1 positive. So we're,
So are we going to have to continue to do that testing going forward?
So last night, the state posted new guidance, and they have changed the mandate. So it's now no longer a mandate. If you're vaccinated, you don't have to be tested.
Right.
Or if you've been infected in the last 3 months, you don't have to be tested. Now the state's encouraging us to use our judgment. If there's some reason to test someone, if there's some suspicion of an infection, despite those 2 parameters, perhaps they should be tested. But it's back to our clinical decision.
Well, this is a very important topic because, and we'll talk about this more today, as more people get vaccinated, there's incentives to being vaccinated. Right. It's not just about protecting yourself or others, but there's other things. So it may be that if you are fully vaccinated and you're going for a procedure, you don't need some additional testing.
That's
which is great. So let's talk about those vaccine numbers. The fresh numbers are total population in New York State. How many have received at least, actually in the Capital Region, how many have received at least 1 dose of the vaccine? Fred, we're at 54.5%, so that's great. It still is the best number in the state. But the population eligible today is changing, and we're going to have more people eligible, so that we're going to see that number go up hopefully very quickly. So Fred, how did the process change?
So we talked about this a little bit on Tuesday. The FDA recommended approval of the Pfizer vaccine for that 12 to 15 age population. And yesterday, the advisory group of the CDC, a bunch of experts from around the country, made that recommendation as well. New York State jumped on it 10 o'clock last night. We both got an email that said it's approved now for that adolescent population. And today, there are multiple places around the Capital Region that you can take your 12, 13, 14, 15-year-old to get vaccinated.
Absolutely. So go to capitalregionvax.org. Vaccine Finder is in there. Put in your zip code. You'll get a list of pharmacies. You'll get a list of other larger vaccination sites. You can schedule an appointment, and some you can walk in. So, Fred, I have 4 children, as you know. One is already fully vaccinated. I have 2 children in that 12 to 15 age group. They're already scheduled to have their vaccine on Sunday, which is great. So, obviously, we hope to see those numbers go up over the next couple of weeks. Fred, talking about incentives. One of the things that people have said is, if I'm fully vaccinated, how much longer do I need to wear the mask in certain settings? And we just read today there is some guidance coming out from the CDC that we may see some change to the mask wearing indoors soon.
That's right, Dennis. We both saw the same news flash as we were walking to the studio. It sounds like the CDC is going to relax some of those regulations, both obviously outdoor already, but indoor as well. So I think we need to look into that a little bit and get a little bit more info on what they're proposing.
Right, certainly not official yet. There's going to be certain locations where obviously they're still going to have masking in place, but other places where it'll open up, and this is obviously tied into more people getting the vaccine.
And that's very important. It's for fully vaccinated people that this change is going to apply.
So there's the incentive.
That's the incentive.
There's the incentive. All right, Fred, it's Thursday. We always talk about length of stay on Thursday, and I think you have a graph.
So let's pop up the graph. You can see we're kind of hovering. Again, the dotted line is total length of stay, and it's about 5.9 days. That includes our COVID patients. The solid line is absent the COVID patients, and that's about 5.7 days. So there's still a delta between them. Those COVID patients do stay longer. We'd like to continue to have that move down, get closer to 5.5 or even 5.4 days total. So we're going to continue to work on that. Dr. Dan Pause's got a group working on it. Our complex care group has been working very hard, a couple times a week. So we're making progress, Dennis, but we have more room to go.
We heard in the safety brief today that the neonatal intensive care unit was actually going to create their own complex care group.
Isn't that
That's
cool?
exciting.
That's great.
So obviously these are young patients, obviously, that often the discharge has some challenges, so they have a group just to focus on that.
And Dennis, this is important for both the patient and the family. If we can figure out all those issues that are preventing that child or adult from going to the next place of care or home, it's good for them if we can really work that out.
For sure. And Fred, last topic today, but I would say it's the most important. We had the privilege, really, yesterday of attending the ceremony where nursing recognized the 2021 recipients for Albany Med's Pillar of Nursing Excellence Awards.
Yes.
And it's been taped. Hopefully, if you didn't get a chance to see it, you can watch it. The stories were remarkable.
They really were, Dennis.
Very inspirational. In some ways, a real window into the tremendous work the nurses do here. The theme that I talked about is that in every single case, as I heard the stories told, one of the themes was that nurse removed some element of fear from the patient, whether it be fear of coming into the hospital, fear of not being able to get a medication that they need, fear of undergoing a procedure. The nurse really played a critical role reducing that, and we know how important that is.
It's incredibly important.
And it's especially important given this last year, which has been, I think, for many people, a frightful year at baseline. And so credit to our nurses, who I think embodied really the spirit of the hospital. And all of us really in the last year, I think, have done a tremendous job as trying to reduce fear. And yesterday was a great example of it.
Yes.
So let's name them, and I'm sure we'll have a picture up for each one of these winners. So I'll do the first 3, Fred. Timothy Hunter, general surgery and trauma. As I mentioned yesterday, Tim's taken care of my mother in the past, so congratulations, Tim. Evelyn DePerna, neonatal intensive care unit. And Joe Bryce, pre-admission services. So those 3, and there was 3 others.
Yes, and Shannon Miller of the SICU, Kathleen Kalmer in VIR, and Erica Regensberger in PEDS GI.
Yeah. And thank you to everybody who wrote nominations for not only the winners, but everybody. As I said yesterday, if you could see, if you were a winner of this award, you were looking at that person when they were reading the stories. The faces
Yeah.
were remarkable,
Yeah,
right?
they really
So
were.
for the person who nominated them, if they could see the face of the person that they were talking about, I think they would realize how important it was that they were recognized.
Can we have a favorite story,
I know which one
nominated
you're.
story?
Sure, please.
So Tom, I didn't get Tom's last
Right.
name, nominated Shannon
Miller.
And he started by saying, Shannon will always shave your patient.
Right.
And it just absolutely resonated with me. Talk about compassion,
Yep.
taking away fear,
Yep.
calmness, etc. It was a very good story.
It was. It was a
Very
special
good.
story. They were all
Very
great,
much.
and
They
that
were
one
all-
was
they
great.
were all special.
That was great. All right, the weather is going to be wonderful this weekend, so hopefully people will get a chance to enjoy
Going to
it.
be cutting my lawn.
I forgot that lawn. Go enjoy the tulips in the park. We know that there'll be people working here over the weekend, and we appreciate them, and we thank them for their work over the weekend, and we'll be back again next week.
That's right.
All right, we ask that you once again, please take care of yourself, take care of each other, and we'll see you on Tuesday.